Question 47, oral cavity and palate. The oral cavity is bordered by lips and cheeks on the front and on the sides. It's bordered by the palate above that separates it from the nasal cavity. And it is the floor is made of mylohyoid and geniohyoid muscles. I'll show you a picture of that afterwards. The oral cavity opens in front in the rima oris, that is the opening between the lips, and posteriorly it opens into the pharynx, and it's called the isthmus fautium, or oropharyngeal orifice. Depends on who you're talking to. The oral cavity is subdivided into a vestibule and an oral cavity proper. Those two cavities are separated by the teeth and gums. So you have the vestibule first, which is very small, and then you have the oral cavity proper. The vestibule communicates with the oral cavity proper behind the molar teeth. There is a opening. The vestibule has a fornix above and below. That is like the top and the bottom space. And then it has the lips and the cheek externally and gums and teeth internally. And a picture to show you the floor of the mouth. Here you have the geniohyoid muscles and the mylohyoid muscle. This makes up the floor of the mouth. Now to talk about lips. They are composed of a muscle called orbicularis oculi that is quite large, and it is covered by skin externally, and internally it is lined by mucosa. The composition is not quite is not the same. That's why it's called skin on the outside and mucosa on the inside, even though it looks very similar. On the inside you can see it has small labial glands. Those are salivary glands, so they produce saliva. And here you have the free margins of the lips, which surrounds the rima oris, which is the anterior opening of the oral cavity. The free margins meet in the oral angles of the mouth. And the upper lip is separated from the cheeks by the nasolabial sulcus. And in the middle you have philtrum that ends in the tubercle. The lower lip is separated from the chin by the mentolabial sulcus, which is underneath here. It is more noticeable on some people than on other people, but it's an anatomical structure. Internally, each lip is connected to the gum below the teeth by the labial frenulum. Here you can see the frenulum. And here you can see the gum, which covers the bone that the teeth are set into. And this upper bone is called maxilla, lower bone mandible. And the gum has no salivary glands at all. The blood supply of lips and cheeks is facial artery. If you see on this picture, this is facial artery on each side, and that supplies the lips and the cheeks with blood, and there's also a facial vein that goes next to it that drains the blood again. And the nerve supply is trigeminal nerve for sensory and facial nerve for motors, impulses. The palate is the roof of the oral cavity, and it is separated into hard palate and soft palate. The hard palate is formed by bone, by maxilla and palatine bones. Right and left parts meets in the median palatine raphe or raphe, which ends anteriorly in the papilla incisiva, which I can show you on another picture. Here you have the incisive papilla, or papilla incisiva, depends on if you want English or Latin. Here you can see the bone of hard palate, and then you have the soft palate, which consists of muscles and tendons of the muscles. And it also consists of mucosa. And back to the other picture, which you can very easily see that the soft palate consists of palatoglossal arch, which is the red one, and also you have palatopharyngeal arch behind here, on each side. And these border the isthmus fautium, which is the posterior opening of oral cavity. So this is an opening called isthmus fautium. And lastly, I will just mention the palatine muscles. You have the tensor veli palatini muscle, which goes here. This, now you're looking from behind and into the nose, and then you have the opening into the mouth here. So this is tensor veli palatini muscle, and it origins on the inferior side of sphenoid bones, and it inserts on the palatine aponeurosis, and that's the expanded tendon of this muscle, and it gives insertion points for, or attachment points for, the other palatine muscles. And it continues into the periosteum of the hard palate in front. So the first muscle, tensor veli palatini muscle, and then levator palatini muscle, this one. Then you have musculus uvulae, this you see it from the back, and here you see it on the front, musculus uvulae. And you have palatoglossal muscle, now you're looking from the front, which is this thin one, and behind it you have palatopharyngeal muscle behind it here. And these two muscles create the arches that I told you about. So palatoglossal arch, palatopharyngeal arch. And in between here you have palatine tonsil. Now the origin and insertions of these muscles. Tensor veli palatini muscle origins on the sphenoid bone and inserts on the palatine aponeurosis. And the action is that it draws the soft palate. It's called tensor. The levator veli palatini origins on the inferior, on the petrous part of temporal bone, and also inserts on palatine aponeurosis, and it elevates the soft palate. The musculus uvulae origins on the hard palate and palatine aponeurosis, and inserts on the uvular mucosa, and the function is retraction of uvula. The palatoglossal muscle origins on the palatine aponeurosis, which you can see here, and it inserts on the intrinsic muscles of tongue, down here somewhere, and it pulls the soft palate downwards. And the palatopharyngeal muscle also originates on the palatine aponeurosis and inserts on the sides of pharynx, and it pulls also the pulsed palate down. Now the blood supply of these muscles is branches of maxillary, facial and ascending pharyngeal arteries, and the nerve supply is from the pharyngeal plexus.